Okay, good evening. Welcome to the 5th Adam Smith Institute webinar. Thanks a lot for registering and spending an hour of your Tuesday evening with us. My name is Daniel Pryor and I'm Head of Programs at the ASI. And for those of you who maybe aren't familiar with us, we're a free market think tank. We're based in London in the UK. And our goal is to try and change policy and public opinion through things like research, media, events, and education. And we've been hosting a series of webinars since the UK went into lockdown that focus on a wide variety of different topics in relation to COVID-19 and public policy more broadly as well. But this evening's webinar is focused on preserving human dignity in the midst of the COVID-19 pandemic. One of our key research areas this year is called dignity, because we think that the best practical approach to help the most marginalized and preserve individual rights is to improve the lives of the least well off through liberalism. But we've got a fantastic lineup of speakers with some expertise in some different areas related to this theme. And I'm really excited to see all of the questions which we'll tackle later on in the hour. I know some of you have sent in questions already. In terms of format, I'm going to kick things off in a second just by talking about rough sleeping and homelessness, and specifically the situation we're in the UK and how COVID-19 has changed that, as well as some liberal approaches to helping people escape from these pretty horrible situations. So I guess I'll just start off now. Then we're going to move to Silky, Neve, and then Maria, and we'll go on to questions towards the end of the hour. I guess starting off with a bit of background on the situation with homelessness in the UK is probably a good place to start. So the latest ONS statistics, which were last year in September 2019, they show that just over 87,000 households are in temporary accommodation, and that's in England alone. And around 4,000 people are sleeping rough on any given night in England as well. It is worth caveating this with saying that the figures around homelessness aren't necessarily precise. So councils asking people on a particular night whether they're rough sleepers, it can be quite an unreliable method. And for rough sleeping, it's just a one-night snapshot. Shelter, for example, the homelessness charity, they estimate that there are around 320,000 homeless people in the UK. So there's a wide variety in terms of estimates. And in placing this in kind of historical context, the generally accepted picture is that homelessness fell significantly in the late 2000s and then started rising again during the 2010s post-Great Recession, although the numbers have started to drop again in the past couple of years when it comes to things like rough sleeping. Not significant drops, but a little bit. Now, obviously, COVID-19 has made the situation of homeless people and rough sleepers even worse. If you're sleeping on the streets, you're clearly more vulnerable to the disease, and providers of shared accommodation, they struggle to deal with any resident that might test positive. Obviously, self-isolation in a homelessness hostel is not particularly easy to accomplish. And the government's response so far, one of the main things that you may have seen on the news has been to house many rough sleepers in hotels. This hasn't been without its issues. In Manchester, about, I think, a quarter of those who were housed in hotels have already left because of struggling to adapt to the new circumstances or antisocial behaviour incidents. But I think regardless, we can say that this probably isn't a long-term solution. So I wanted to talk a little bit about kind of post-COVID, what we can do in terms of policy reform from our angle, from the kind of free market angle, but also something that I think is shared across the board. And the first strand of this is specifically targeting those with high and complex needs who are homeless. So they might also be suffering from mental health related issues. There might be substance misuse issues as well. They might have had contact with the criminal justice system. And then the second strand is kind of looking more at the broader housing market and how we can reform that to provide more affordable housing for as many people as possible. So when it comes to tackling chronic homelessness and those with maybe multiple issues in relation to this, the real solution here that I think is championed across the spectrum is something called Housing First. And for those who maybe aren't familiar with Housing First, it basically does what it says on the tin. It gives chronically homeless people some stable accommodation, and that can be used as a platform to tackle other issues which might have led to their homelessness or developed as a result of them sleeping rough. It's an approach that was first developed in the US in the 1990s. And in the UK, at least, there are currently some larger scale trials in places like Liverpool, the West Midlands and Manchester as well. There's some trials being done, as well as some smaller providers that are working with fewer clients elsewhere. And with Housing First, it's delivered with a mix of social and private accommodation, depending on the area. And it also has mobile support workers, so they can connect people in the Housing First programs to other support services. And I'll say more on that a bit later. But the idea is pretty simple. If people are in secure accommodation, if they have access to trained support staff, it's easier to solve some of the other related issues like mental health or substance misuse, etc. And it's useful to illustrate this approach by contrasting it with what we've had in the UK, parts of the US and Europe for quite some time. And that's the housing ready approach. The idea of this is training up someone to become housing ready. The problem with this, and is pretty clear in my opinion, is that this doesn't always work. So some hostels are dry facilities, for example. If you have a drinking problem, you're not going to be able to use those. You're going to get chucked out and stay on the streets. Other places might ban pets, like dogs, for example, or they might require commitments from previously rough sleepers to have a certain amount of support hours, for example. And all of these kind of strings attached mean that actually this kind of housing ready approach doesn't work for everyone. And it certainly doesn't work for people with high and complex needs. But the key idea of Housing First, by contrast, is the separation of housing and the support services. There's not expectation that you stop using alcohol or drugs in order to access these services. So it's kind of based on the idea of harm reduction. And it works best when it's paired with these allied services. So mental health, addiction recovery. In the case of homeless refugees, it can be social integration services as well. And I'll maybe go over the international evidence here a little bit. I don't want to bore you all to death, but probably the best thing I can point to is a recent Glasgow University study. It looked at all these different studies that have been done on the effectiveness of Housing First and found that recipients were 2.5 times more likely to be housed after 24 months. So that's a pretty big improvement on treatment as usual. And recipients are also less likely to experience bad health outcomes. So things like hospitalization or emergency department visits in the US. And there's also the kind of point about cost effectiveness as well. So obviously the first point that pops up in many people's minds, certainly if you're on the center right, is this actually cost effective? Doesn't it cost way more to give people housing and then focus on the issues? And there's been some speculative work in this area. So in the US, there was a longitudinal study that showed significantly lower cost. In the UK, the work, it probably wouldn't pass the Treasury sniff test. It's not kind of gold standard, but the evidence we have suggests that Housing First also tends to reduce costs compared to other fixed site services like hostels and temporary accommodation. And in part, this is because the level of support that Housing First gives to service users, it tends to fall over time. Because it works, it doesn't take as long to kind of move people out of the most negative situations. And of course, it can also save the NHS and the criminal justice system money because it reduces rough sleepers' contact with these services. So they're less likely to experience health problems, so they're less likely to need to use the NHS as much, and also they're less likely to come into contact with the police. This isn't to say there aren't issues with this approach. There's a lack of kind of gold standard randomized control trial evidence in the UK on how effective it is. Elsewhere, it's pretty solid. There has been some issues getting buy-in from landlords around this, but the way that providers have tried to solve that is by making Housing First act as the property manager. And the other thing is making sure that whilst we're trialing it in the UK, we actually target it at this kind of chronically homeless population, those with high and complex needs. It's not a solution that tends to be the best or even necessary for other people who are homeless, but it's important to target it right. And this is something that's got support from across the political spectrum. Organisations like Crisis want Housing First. The Adam Smith Institute wants Housing First to be expanded in the UK. Plenty of other homelessness charities and organisations on the left of politics also support this approach. And that's all I'll say about it for now. But the real expert on this, if you want to learn more, is a guy called Nicholas Pleece, Professor Nicholas Pleece at York University. He's the guy that's really leading the charge in this in the UK. The second strand that I wanted to talk about this evening is related to the broader housing market. So more generally, pretty clearly, if you want to reduce homelessness, then people need houses. There's pretty clearly a housing affordability crisis in the UK. I don't think that's a controversial statement. Perhaps slightly more controversial is to say I think this crisis is caused by a shortage of housing supply. There are some people who dispute this. I think they're wrong. And the low housing supply is in large part pretty clearly down to planning laws and how restrictive they are. If you don't believe me, if you want to kind of fact check me or whatever, then please ask a question in the Q&A. Also check out the LSE's Professor Paul Cheshire and some of his work, because he's really an expert in this. Now, there's a very large body of economic research that shows a clear relationship between housing affordability and homelessness. Again, if you can't afford a house, if you can't afford to rent, you're most likely to end up homeless, whether that's couch surfing or living in temporary accommodation. And this is especially true in larger cities. So there's also evidence about how reforming planning laws to be less restrictive, this can play a really huge role in reducing homelessness and rough sleeping. So it's not just about this kind of housing first approach targeting specific individuals with high and complex needs. It's also about broader housing market reform. And this can be anything from, say, letting residents of a street vote on giving themselves planning permission to, say, extend or replace some of their existing homes, maybe build an extra story on top of their homes, anything from that to freeing up small areas of the Greenbelt. The Adam Smith Institute's proposal was freeing up 3.7%, all of that within walking distance of train stations. That would net about 1 million new homes per year. And interestingly, there's also been some support for less restrictive planning laws from homelessness charities, like Shelter, for example. Sometimes, though, they tend to go for the more building on brownfield land option, but in large part, this is already being built on. It's also often very costly and less environmentally friendly, or quite simply, it's not in the right places. One of the things about Greenbelt land is it tends to be in places that people actually want to live. And therefore, some development in certain areas can be especially useful for reducing housing and renting costs. And in the UK, we've helped push through some reforms already in this sort of area, alongside groups like London YIMBY, neighbourhood development orders being a good example. But I think looking at time, I'm probably just about out of it now. So I guess I'll finish up. I think it's pretty clear in relation to the broad theme of this webinar that homelessness is a huge affront to human dignity. And policies like Housing First and sensible deregulation of certain planning policies are part of a free market solution. It also has a strong relationship, homelessness that is, to some of the other areas of concern that we're going to be discussing later on in this webinar. But that's it from me. We'll switch over to Silky in a second. Thanks a lot for listening, and I look forward to taking your questions later on. I'll just switch on Silky, and hopefully we'll get a video in a second. Wonderful, wonderful. And can we get an audio test as well?
Can you hear me?
Yes, I can hear you well. So for those of you who don't know, Silky Carlo is the director of Big Brother Watch. It's a leading civil liberties and privacy NGO, and she's going to be discussing some of the issues with the government's rather draconian new powers in policing and how to reconcile civil liberties with public health goals, which I believe actually Big Brother Watch, you've just released a report on, what, an hour ago? I'm sure you can tell us more anyway, so I'll hand over to you, Silky. Thanks. It's all yours, Silky.
Oh, sorry, it's just me staring into space. Well, thanks so much. It's great to be with people virtually, and yeah, this is very interesting timing for us indeed, because we have just published our, and when I say just published, I mean hitting send as I'm logging onto this call. We've just published our first Emergency Powers and Civil Liberties report. So naturally, like many people with a passion for liberty and rights in the UK, we have been extremely nervous about the extraordinary loss of liberty that we've experienced in the past few weeks, and the prospects for how this might expand, about how it might endure, and looking for ways that we can try to limit this as much as possible. So we briefed on the coronavirus bill when it went through Parliament, but we made a commitment, because the extraordinary length of that legislation in particular, we made a commitment to report every month on the country's response to the pandemic and the impact on civil liberties. So anyone that has an interest in that, please do check out our website, and on the emergency powers page, the report should be there. If you go to the monthly report section, we've literally just hit send on that. We haven't tweeted about it or anything yet. We're going to do that shortly. Just to give you, I'm sure, you know, unless anyone's been completely, I was going to say hibernating, well, I guess we all have to some extent, unless you've had your head in the sand, you would have seen that we have had some pretty inconsistent, sometimes incompetent and unpredictable policing over the last few weeks. And of course, the police have had a hard job on their hands, and this situation is taking a toll on everyone, but it's important that naturally we hold it to account. And I think also in the course of the policing of the pandemic, we have seen institutional failures really come to light and be exposed. And these are sometimes things that I think civil liberties campaigners experience a lot, or actually people in vulnerable groups, in fact homeless people being one of them, people with drug problems, ethnic minorities, campaigners, all the kind of groups that are particularly policed or experience this kind of incompetence on a regular basis. And actually, it's one of the interesting things I think about the emergency situation that we're in, is that it's coming to public attention in quite a significant way. And I'm going to give you some examples of that. Although I appreciate, I think a lot has been across the headlines, people have seen how extraordinary some of the policing has been. But we need to look at also the powers that authorities now have, and what the prospects are for some of them being rolled back. So the report has gone out today, and alongside it, we've just again literally just had a piece published in the Times, which looks at one of the case studies that we found, which is someone who has been wrongly convicted under the Coronavirus Act. So there are two major pieces of emergency law that we look at in the report, alongside other things like location tracking, the contact tracing app, NHS databases. There's so much going on. But in terms of the legal changes, there is the Coronavirus Act, which is 342 pages of some of the most eye-watering powers imaginable. And then there are also health protection regulations which have come in, which last for 6 months at a time. That's a statutory instrument, whereas the Coronavirus Act lasts for 2 years. We campaigned for a review to happen before that, and there was a successful campaign. There is now a review of the Coronavirus Act after 6 months, which is going to be really important, because the way that it's been used so far has been absolutely disastrous. What the Coronavirus Act does is it gives a whole host of powers that hopefully you will have seen very rapidly being discussed, because this went through Parliament in 3 days. Reducing standards in social care, reducing the threshold that you can be sectioned under the Mental Health Act. There's an enormous amount in there. I don't even know where to begin. The two things that are particularly relevant from a civil liberties point of view is Schedule 21 and Schedule 22. 21 gives powers to police, and in fact any kind of an officer of various descriptions, to forcibly isolate, detain, quarantine, and take biological samples from people. That's the purpose of that schedule. Schedule 22 is dispersal, and that's what breaks up gatherings, anyone basically coming together. And it doesn't have a protection for protests, which the Civil Contingencies Act does provide for, which many people in Parliament, David Davis MP included, questioned. But so we were expecting that these powers might be used in the course of policing the pandemic, but they haven't been, for the most part, except for this wrongful conviction that I'll tell you about, and many others. the health protection regulations have been used to police the pandemic, which basically put in place the major effect of that is putting the nation under house arrest. And extraordinarily, that hasn't even been approved by Parliament. It's just a statutory instrument that has been laid before Parliament just before the recess, and so it actually hasn't had any scrutiny or input whatsoever. And yet it's the greatest loss of liberty in a generation. And me saying that is not to question the necessity of it, which is a different discussion, but to just acknowledge such a sobering fact, and just how vulnerable our rights and liberties are, which I think is why the work that we do is really important. So there's wrongful conviction. There's been a number of them now, but essentially we've seen that the police have a very loose grip, by and large, on the extraordinary emergency powers that they now have, and so some of them have used the Coronavirus Act legislation, which is supposed to be about kind of detaining people that they think have coronavirus, putting them in quarantines and taking biological samples, like the extra dystopian stuff. But this has actually been used in the course of general policing. And the case that there's been a few cases of this. There was a woman at a train station in Newcastle, which you may have seen, it's reported on quite widely, who was actually spent time in custody as well after she was wrongly convicted under the Coronavirus Act for not explaining where she was going, which isn't even a power that Act confers, let alone the fact that act shouldn't have even been used in the first place. In this new case that we've identified, it's a teenager from Oxford, an 18-year-old boy. He's gone to visit his mum and has been followed by the police and then convicted under the Coronavirus Act, Schedule 21. But worse still, he was convicted under the Welsh powers of the Act, not even the English ones. And as human rights QC Kirsty Brimelow says in the Times piece that we've just worked on, a lot of things are happening in the pandemic, but Oxford hasn't moved to Wales. And it's just a really, really quite alarming, I still can't even really get my head around it. It's really just such an alarming example of how hard and fast the policing has been over the past few weeks and the kind of mistakes that are being made, let alone the fact that this poor teenager actually pled guilty to this Welsh Coronavirus Act charge. And, if you end up with a criminal conviction, of course, that can really affect someone's life course. We're only finding out about these cases through really quite laborious research, and we're a very small team. There's a limited amount that we can do, and other cases have come to light through journalists. So there's really not an effective kind of transparency mechanism here, and a lot, of course, we're finding out about on social media. That's just one example. I think that the wrongful convictions is obviously incredibly concerning, but it's really a symptom of the deeper problem. The deeper problem is that the world has just changed, and the world has changed, I think, more than it did in already. You get the sense that the world is changing more than it did in the 9/11 years. And we know that from in times of crises like this, the state of emergency persists. And we will see some lasting changes. We have already seen the use of drones for surveillance, public shaming, encouragement of citizen reporting, the use of megaphones, a real abandonment for the rule of law, not only in the wrongful convictions that I explained, but in police effectively making up the rules as they go along, seeking to enforce police guidance rather than the law, which are two different things. And then when that's been pointed out, as we explore in the report, some police forces are saying, well, actually, the guidance is better than the law. The guidance is better than the regulations, and that's what we'll continue to enforce, genuinely. And so all of these all of these parts of the kind of policing response to the pandemic are real cause for concern. And I would urge anyone who has an instinct for liberty to not see this. We can't see this as just, oh, this is a 3-week aberration in the normal course of life. It's not. It's a fundamental rewriting of the nature of a liberal democratic society. And the opportunity to try to have an influence on what this new world is going to look like is now. And I think if we're complacent, we will see extraordinary change, the growth of a surveillance state like we've never seen before, biometric surveillance, under the skin surveillance, health surveillance. And yet again, another worrying aspect of the nature of this emergency, much like 9/11 and panic around terrorism, is that because of the nature of the emergency, we're encouraged to see other people as potentially dangerous to us. There's long been with the Prevent scheme and other things, a kind of sense that everyone could be an extremist, anyone could have extreme views, and now the worry is that anyone can be infectious, and that social fraction is very concerning as well. So I think it's easy in these extraordinary circumstances to feel disempowered and to feel and I know it's, for me personally as well, sometimes this is just a real struggle because it's alarming and it's really worrying. But with groups like ours that really care about liberty and freedom, and I would encourage anyone that does to please join, because that's the most important thing that you can do. We've got to come together right now, identify the places to take action and try to do something about this. This is not just about having a go at the police and being pedantic about or academic about differences between regulations and laws and so on. It's really not. It's really about the fact that the nature of the crisis will introduce a new political order, and we need to have a say about what that looks like. It will naturally try to bend towards authoritarianism, and the laws are there for an unrecognizable dystopian society. That's a very uncomfortable position for us to be in, and we absolutely must do something about it. I expect that I've used up my time, so thank you very much.
Yes, we've already got some questions coming in for you, so thank you very much for that, Silky. I will just go to our next speaker, which is Niamh Eastwood, who is the Executive Director of Release, which is a national centre of expertise on drugs and drug law, as well as other topics. Release provides free, non-judgmental specialist advice and information to the public, as well as professionals on issues related to drug use and drug laws. And she's going to be discussing how COVID-19 has affected people who use drugs, as well as some of the things that we can do to improve their situation. So I'm going to get her on video and hand over to Niamh, if she is here.
Yeah.
Yes, she is. Wonderful. And there's the video. Niamh, over to you.
Thanks, Daniel, and thanks for the invitation to speak. I suppose picking up a bit on what Silky just said about the idea of kind of the othering, how the war on terror was used as an excuse to oppress certain groups. But I think that's an experience that people who use drugs, especially those who use problematically, have experienced for decades now. Certainly not to the level of surveillance that Silky is talking about, and the kind of stretch of those powers, but that sense of control through police law enforcement. And how policing has been used to address what is predominantly a public health issue, rather than really looking at the symptoms of some of the drivers for drug use. And I suppose that's kind of where I want to start, is to say, when we look at people who use drugs, we often get a specific stereotypical image in our heads. But in fact, 90% of people who use drugs use in a recreational manner. There is no harm to themselves. The greatest harm that they face is criminalization. or that their drugs are adulterated, and that's obviously because the market is unregulated. For this population moving into, or this group of people moving into COVID, we weren't that concerned. I think people could give up their MDMA use for a while and enjoy it when they return to a society where we get back to whatever normal looks like. And it was really those 10% of people who are dependent, problematic users that were our real concern. And these are people who are part of our community at release. We work closely with people who have a history of heroin and crack cocaine use and other substances that they use often to self-medicate. The vast majority of the people who are dependent have a history of trauma in their lives. They've been sexually abused as children, they've been physically abused, and so their use of drugs is a way to alleviate that emotional trauma. And if you think about it, that's a really rational response. Every day in hospitals across the country, historically, we have been treating people with morphine to relieve physical pain. It's very natural for people to seek out substances to relieve that very deep emotional pain. And it was really this population that we were concerned about. There is a proportion of that population of people who are in treatment. But again, a bit like policing, treatment has historically sought to control this population. And so often we would have clients, and we're talking here, thousands and thousands of people across the country in treatment who are in receipt of methadone and other substitute medication for heroin dependency. And they would be on daily supervised pickup. Now, in the vast majority of cases, this was not about clinical need, rather it was about, as I said, controlling them, making them jump through hoops in order to get their medication. If someone had gone in to see their sort of key worker, the person who deals with their case at a drug treatment center, and they disclosed that they were using heroin, for example, on top of their medication, they may be pushed back to daily supervised consumption, despite no clinical risk for that. And the analogy I often use is if someone is diabetic and they go into their doctor and they talk about you eating chocolate at the weekend, we wouldn't apply a punitive treatment regime to this group, but we do with people who are dependent on drugs. And that all changed when the crisis hit, when we could see that the lockdown was coming and coming quite quickly. And I have to say the treatment providers, took Herculean efforts to get thousands of people off daily supervised consumption onto longer term scripts, so that we now see people who a month ago were having to go every morning to the chemist to collect and consume their medication, now in receipt of weekly and fortnightly scripts. And I think that's possibly a silver lining in all of this. And what those who have been in treatment, who are experiencing this new regime, have said is that they're being treated with dignity, and kind of goes back to the title of this talk, this panel today. When you treat people with dignity, they want to engage with treatment. There's kind of a mutual investment in outcomes. And people are having a better time as a result of that, and they feel less like they're being treated in a very paternalistic way. So we see that as one positive. Also too, what we've got is a situation though where we have tens of thousands of people now seeking treatment as the heroin market seems to be destabilized a bit. I'll get to that in a moment. But essentially, we have a treatment system that's been cut by 26% in funding over the last 4 years, largely due to the austerity measures of this government and previous Conservative governments. And in fact, what we need to see is not only that cut in funding replenished, but also scaled up to meet this new demand of people who are seeking treatment as they can no longer access illicit drugs through the unregulated market. And so we see this as an opportunity, but to date, there has been no commitment to funding. The other thing which kind of ties into all of this is policing. And one of the concerns that we've had is that, many of the people who are using drugs like heroin will need to go and pick up their injecting equipment. And this reduces the risk of BB fees. And so we've developed things like essential journey cards so that people can identify that this is an essential journey, that this is to protect their health and the health of the public. In terms of policing, we have had reports from across the country of police seizing alcohol where it is not purchased with food. So that someone's gone down to the off license and picked up some alcohol, and that's not deemed to be a essential item. But if someone goes off to Marks and Spencer's, buys, you know, a £40 or £10 worth of food and, you know, a box of wine, that's fine. And as you can imagine, the profile of the people who are being stopped and their alcohol seized are often people who are dependent drinkers. And that's really problematic because withdrawal from alcohol can cause huge health harms, including death. So, I mean, these are issues that need to be dealt with through health and not through policing. In terms of the policing of possession of drugs, we've really pushed both at a government level through responses to committees, by bringing this up with senior police officers in, you know, the National Police Chief Council, and said, you know, this needs to be deprioritized immediately. And certainly in some parts of the country we're seeing that, but in some parts of the country people are still being arrested for small amounts of cannabis, and this is really not a useful use of, or it's not useful in terms of police resources, and can cause significant harms to individuals around kind of criminalization. And interestingly, we're seeing them being arrested rather than getting out of court disposals. I think next month we'll get the data from the Met Police, and it will be interesting to see the scale of stop and search under the traditional powers. And we're really concerned that drug policing continues in the capital. In May and March, for example, the level of stop and searches was at the same level as the month before. 60% of those stop and searches were for drugs. So I think, you know, even though we're on lockdown, even though these new police powers exist, which are really draconian powers, we also have the traditional policing going on side by side, and we're concerned about that. The other thing we've called on government and police to do is basically to stop policing the drugs market itself, the supply side. I mean, in fact, what we want to do is try to retain stability in the market. At the minute, our understanding is that the heroin and cocaine market is pretty robust, but that could change. And what we need to do is keep those drugs available within the country, because if we start to see heroin droughts, or droughts of crack cocaine, we will see people move to more harmful substances such as fentanyl. And I think that's one of the things that we're really concerned about is the rise of fentanyl within the UK. It's much easier to import. I know most of it comes from China, and there was the lockdown there, but that's easing. And it's about 1,000th of the quantity that you need of fentanyl compared to heroin to serve the same size of the population. And, you know, the drug-related death situation in the UK was already a public health crisis. We already had, for the 7th year in a row, the highest rates of drug-related deaths since records began. In Glasgow, for example, the rates of drug-related death are comparable to the US and Canada, and that's without fentanyl. In order to kind of respond to this, we've done a number of things. So we've set up a survey, which is on the Release website. It's on the homepage, it's release.org.uk, which we're encouraging people to fill in. It's completely anonymous. We're not even picking up IP addresses. We're trying to make sure that it is as confidential online as it can be. We've also set up a network of people across the country who are drug user activists, service users, recovery workers, harm reduction workers, who are all feeding in to let us know what's going on in the market. And as I said, the main trends at the minute is the market is relatively stable. We're seeing prices go up. Purity is going down across most of the substances except cannabis. And there is smaller quantities of drugs being supplied. I think the really problematic sort of phenomenon that we've seen is that for a certain group of people who are dependent on drugs, it's really hard for them to sustain any income. All of their income sources have gone. And that includes things like begging, tapping. Not all people who sex work use drugs, but there is a population that do. For them, the ability to sex work has completely dried up. So we're seeing a really vulnerable population who live in extreme deprivation now, not having any access to any income. And that's a real worry. And for many of those people, they are having to go through a forced withdrawal, which is deeply unpleasant and in many cases can be fatal. For example, if it includes benzos. And again, this comes back to the need to be able to allow to have access to treatment which can support this population. And the other thing we've got is on the website, people can report what's going on in the market. It's drugreport@release.org.uk. And just finally, one of the other things we've been working on is prisons. So as many people will be aware, the Ministry of Justice announced that 4,000 prison releases would take place. That announcement was on the 4th of April. To date, 33 people have been released. 15% of people who are in prison are there for drug offences. It's thought this, or in 2018, 69% were there for non-violent crimes, with 46% sentenced to less than 6 months. 33 people released out of a potential of 4,000. You compare this to other countries in the world. Myanmar has just released 25,000 people from prison. That's a quarter of their prison population. Iran has released 85,000. And the UK has lagged behind and seems to not care at all about the health and well-being of prisoners or the staff who work at prisons. So I think for us, that's kind of the next thing that we want to really focus on advocating for, alongside with the prison reform organisations, and to look at decarceration in the time of this pandemic.
Well, thank you very much for that, Niamh, and for all the work that Release is doing as well. It sounds like you've got a lot on your plate at the moment, to say the least. We're going to move on now to our final speaker before the Q&A, and that is Maria Stevens, who is the Advocacy Manager at Refugee Action. I'll just get the video going there if I can. And so for those of you who don't know, Refugee Action is an independent national charity, and they provide advice and support to refugees and asylum seekers in the UK and campaign for a fairer asylum system. There's a little bit of background. The Adam Smith Institute is part of Refugee Action's Lift the Ban campaign to let asylum seekers work while they await the results of their application. A number of very good reasons why we support that perhaps we can go into later. But Maria's going to be going through some of the issues that refugees and asylum seekers are facing under lockdown, and how certain policy reforms, both now and post-pandemic, can help alleviate that. So I will hand over to you, Maria. Thanks.
Thanks, Daniel. Yeah, thanks for having me here today. So as Daniel says, I'm from Refugee Action, and we're a national charity providing advice and support to refugees and asylum seekers in the UK. I'm the advocacy manager, so I'm based in the campaigns team. But as well as campaigning, which we do for a fairer asylum system, we also provide frontline support to refugees who come here through the government's resettlement schemes. And we also provide advice and support to people in the asylum system on their applications, and also while they're in crisis. So today I'm going to talk about some of the issues facing refugees and asylum seekers. Issues which have worsened during the pandemic, but many of which stem from systemic problems with the asylum system in particular. And I will highlight the policy changes needed now and beyond the pandemic, which are essential to ensure that people who come here in search of sanctuary, often fleeing war and persecution, are able to live in dignity and are not left out in the cold. I think, like other speakers, we've got some very serious concerns about human dignity in the context of the pandemic for the people that we work with. And I'll start with some information about some of the work that we do, but then I'll speak about the issues facing refugees before moving on to more detailed focus on problems with the asylum system, including housing, levels of financial support, and the right to work, which is the Lift the Ban policy that Daniel's mentioned. In the COVID-19 crisis, it's, from our perspective, it's the people in the asylum system out of the groups that we work with who are currently facing the most severe challenges. And the recommendations that I'll outline are also recommendations that we've tried and are pushing with the Home Office. So most of the work that we do with refugees is with resettled refugees who come to this country via the government's Vulnerable Persons Resettlement Scheme, which is focused on people from Syria, or through another smaller resettlement scheme called Gateway, which is focused on different parts of Africa and the Middle East. For those people who arrive here through such schemes, they're offered housing on arrival in different parts of the UK. And the services that we offer provide crucial support to help them integrate across key services like English language classes, getting support around accessing benefits, and other issues like healthcare or getting your children into schools. And currently, all of our face-to-face support has obviously ceased, so it's all moved to online. Now, in general, problems faced by many refugees include isolation, mental health issues, and a kind of lack of local community, all of which have been exacerbated in the pandemic. Many refugees live on a very low income, lacking language skills, they're isolated, and often they're struggling due to restrictions on movement to see people they know or get any support. For others, digital exclusion is a big issue. Not all of the people that we work with, and I know that other organisations work with, have internet at home. They're very reliant on libraries or other places to get health information, but also to access the mental health services now that they need, because these are all online. Additionally, as people who are often visibly from other cultures, they're at risk of hate crime. As some strands of the media have been fueling a narrative which associates migrants with disease carrying. Further to that, resettlement globally has now stopped, and we're concerned about when it will be possible for people to start arriving here again, because when they're not arriving here, they're being left in camps or other situations of risk, including war zones. However, all of that said, for asylum seekers, the situation is actually even worse. So currently there are terrible problems with the asylum support system, and I'll just explain a little bit what that actually means. So when people arrive here and they apply for asylum in this country, then they need to apply for a form of asylum support. And that would mean that they receive payments and accommodation while they wait for a decision on their application about whether or not they'll get refugee status. There's some different forms of support, and they all offer a payment of around £5 a day. So about £37.75 a week is the most common form of support. This money is paid onto an Aspen card, which is a kind of, it almost functions like a debit card, but it's restricted. So it can only be used in particular shops. It can be stopped if you make purchases that aren't considered, a part of your living costs. And it can't ever be used to make payments online. For people on particular types of emergency support, then they're also unable to take out cash with this card. And people, as we've said, who are waiting for a decision on their asylum claim are generally banned from working. So that means they're unable to take action to support themselves financially to increase this amount of money that they're trying to live on. So at the best of times, you can see that the asylum support system leaves people with inadequate levels of support. Additionally, the accommodation that they're housed in is often substandard, and they can barely afford to meet their basic needs. And they're not allowed to work to improve that situation. In the current crisis, all of these problems have magnified to life-threatening situations, which are putting some of the most vulnerable people in our society at the greatest risk. The current process for moving people to accommodation has broken down. People are often waiting months and sometimes years for a decision on their asylum claim. In this waiting period, they're normally sent to specific housing. Currently, there's not enough housing available. So what that means is people are either being forced to stay in precarious situations. That might mean sofa surfing, where they're having to change accommodation every single night. Some people are staying in situations of abuse of different kinds, domestic abuse. But for other people who are housed because they're facing destitution, they're being sent to what's called initial accommodation. And initial accommodation, similarly to the hotel accommodation that Daniel spoke about at the beginning, is often very, very overcrowded. It's impossible to self-isolate in this kind of accommodation. And that means that people are being forced into great risk. We've actually had examples of people not only being forced to share rooms, but also to share beds. And that's included people that we work with who have underlying health conditions which make them more vulnerable to infection with COVID-19, for example, being HIV positive or having tuberculosis. And still they're in these overcrowded conditions. This means that despite being desperate to self-isolate, people in the asylum system are unable to do so. Now, there are some efforts being made by the Home Office, which we definitely recognise, to address problems and to house those people facing destitution. But nonetheless, the conditions are often unsanitary, and the accommodation providers often aren't offering what they should be, which means cleaning materials, and in some cases there's not enough food for people to eat, where they're meant to have their meals provided. Now, as I've said, because of the conditions of risk, which are very, very clear here, what that means is that some people are leaving their asylum accommodation, which can negatively impact their overall claim here, and it also puts them back into the situations of risk, so they'll make themselves destitute again or return to a dangerous situation. Also, the rates of asylum support mean that people are struggling to buy adequate food. So often they can't travel now to cheaper shops because of travel restrictions. In some parts of the country, there's no transport available. And that means that they're being forced towards smaller shops where food is more expensive, and asylum support won't cover the cost of your basic needs if you're buying expensive food. So an example of this is that organisations are trying to make one-off payments to people to prevent destitution. And for Refugee Action, our destitution emergency payments have gone from around £15,000 a year to £2,000 to £3,000 a week. It's quite an increase. And also, because of the Aspen card system, this means that people in the asylum system can't buy food online or really ask others to pick up groceries for them or medication if they can't access cash or they can't find ways to pay for their prescription through other people. And that means that even for people who are trying to self-isolate, who may be unwell or who may be vulnerable to coronavirus, then they're still forced to leave their accommodation, which I certainly don't think is protecting their human dignity in any way. And then further to this, I've mentioned that people in the asylum system are prohibited from working. Now, current rules mean that you're only allowed to work if you've been waiting for over a year for a decision on your asylum claim, and your job is on something called the shortest occupation list. So that's a highly selective list, which includes occupations such as classical ballerina. It does include some key worker roles, for example, doctors, but not all, especially not at the kind of what would be considered lower skilled side. Now, we actually only know of 2 people through our work, and we work with quite a number of people who've been able to work under the current rules. So that means that despite the ludicrously low amount of money people in the asylum system are given to live on, they're unable to gain employment and earn money so that they can live in dignity. In this crisis, this has become another factor pushing people into life-threatening situations of poverty and preventing them from living in dignity. Many of you know, I'm sure, about our Lift the Ban campaign, because it's one that, as Daniel said, ASI support and are involved in. And that seeks the right to work for people in the asylum system after they've been waiting for 6 months for a decision on their claim. Currently, of the 44,494 people awaiting a decision on their asylum application, 57% are waiting more than 6 months in their research, waiting for more than 6 months for a decision. In research carried out by Lift the Ban, 95% of people we spoke to told us that given the opportunity, they would want to work. So I think that now, more than ever, the value and importance of giving people in the asylum system the right to work is being shown. Lifting the ban would present a potential savings to the public purse of over £40 million, as well as multiple benefits on a human level. Now, I'm just going to finish by outlining some of the changes in terms of policy that we're currently pushing for. And these are changes that we'd like to see in the context of COVID-19, but also beyond that, because what this crisis has shown is that, in particular, our asylum system exists on a knife edge, and the changes that we're pushing for now are absolutely essential to ensure that people are actually able to live in that system. So we would be asking for an extension of the refugee resettlement programmes to ensure that people can continue to come to this country through safe and legal routes after the crisis has passed. And we're also asking that the Home Office and its accommodation providers must, in conjunction with public health experts, urgently assess the adequacy of asylum accommodation provision in light of the COVID-19 pandemic, and they must ensure that it complies with public health requirements. So what that means is that people are able to socially distance where needed, people can self-isolate, and also that they have access to Wi-Fi and accommodation to enable them to keep in touch with support services, or to carry out education, or to keep in touch with other people. As we know, it can be quite isolating experience for all of us being in lockdown, let alone without the internet. And we also continue to call for structural changes to asylum support rates. So we'd like to see a link reinstated with mainstream benefits that was in place until 2008, which would see asylum support levels be at 70% of the universal credit rate. And that would ensure that people seeking asylum are able to meet their needs both during and outside of a public health pandemic. And due to the urgency of the current situation, we'd like to see that the Home Office could ensure that asylum support rates receive the same £20 COVID-related uplift as other mainstream benefits. All financial support should be available through cards that enable the user to withdraw cash and to purchase items online, and to make card purchases in shops. And further to that, we would like to see provision for the right to work for people who've been waiting for more than 6 months for a decision on their asylum application, unconstrained by the shortage occupation list. So that's quite a quick run through of quite a lot of information, but those are some of our main concerns in the current context.
Well, thank you very much for that, Maria. As I've just posted in chat, we've run slightly over time, so we're going to extend our Q&A and finish up a little later at 7:15 p.m. UK time, so in about 15 minutes or so. I'm just going to get everyone back in the video so we can start taking some questions. There's 3, and there's 4. So the first question I've got is for you, Maria, actually, and it's on this idea of pull factors. So does a lenient, well-meaning refugee policy create a perverse incentive for more people to come? And I've got some thoughts on this, but you're the one with the expertise here, I think.
So the question on the pull factor is one that we get a lot, and it's one that's been put forward by the Home Office. We've done our own research, and it has always been found that actually, I think over 70% of people that come here don't know about the kind of asylum system that they're going to be entering into. So they actually think they will have the right to work, and they assume that they'll have many more freedoms than they actually do. And in fact, on one occasion, the Home Office actually carried out its own research into the pull factor and also could find no evidence that backed up the idea that it would work as an incentive. So it is something that I understand functions as a concern in our minds, because it would seem that it would draw people here, but there's actually no evidence to support that.
Yeah, just to add to that slightly, there's a really good piece of research from a couple of colleagues that have written for us on immigration policy, and it's looking at whether there's a pull factor, or whether there was a pull factor from the US amnesty in the 80s, and just found absolutely nothing. And that's for, a full-blown amnesty as well. So you'd be surprised if there was a kind of significant effect from more gradual reforms to the refugee and asylum system. Second question I've got is for Silky, and the person who's asked this is talking about how information about things like age, sex, ethnic origins, etc., can all be a contributory factor to COVID-19. And knowing about these might help develop and implement some effective medical treatments. So the question is, what information should the state be entitled to demand, and what information should only be recorded with the patient's permission?
That's it's a really big question.
Yeah.
It really depends on precisely how data is going to be collected, and it's a question that we're facing at the moment with the idea of the contact tracing app, because the idea of centralizing it, I believe, rather than going for the privacy protecting model, is that much more data will be able to be collected and much more research can be done with that. My my instinctive response to that, having not seen the detail, which of course we'll wait for, is you can't treat a population of people like guinea pigs, and you won't get accurate data if you're taking it rather than having people voluntarily give it because it's for a purpose that they believe in. And given that we are, as everyone says, we are all in this together, if proposals are brought forward for the collection of data, and potentially even very intrusive data, that people feel is justified and is going to benefit themselves and the wider public, then I think there will be people that will do that. My concern is that by being draconian, authoritarian about it, and in fact that's the way the government has really gone about this whole process, is with a great deal of opacity and centralisation, which really overlooks the nature of the challenge. A public health crisis quite uniquely requires the willing, informed cooperation of the public en masse. This isn't something that can be solved through sheer power from Whitehall alone. And I think that principle applies to data collection as well. You need to have buy-in of the people, and information and consent, and trust in the way that this whole issue is handled.
Next question, probably best for you, Niamh, this one. So the questioner says, one thing I can see is the rise of mutual aid groups spawning on Facebook. Some are organised by postcode. I can attest to that. I got a letter through the door the other day from one local residents group that just formed. People helping each other. Could this type of citizen-led voluntary initiative be better than making centralised decisions to government? And I guess, Niamh, for you, I'm interested to know what sort of role that volunteers play in drug harm reduction work and releases work, and whether it's a kind of something that central government needs to take the lead on, or actually is it something that more local community work can be a big part of?
I mean, I don't think it's an either or. I've experienced both national-led policy in this area and implementation of that policy and localism. You mean, obviously mutual aid it comes from kind of the drug treatment sector. I mean, it's really interesting to me to see this whole kind of conversation of mutual aid when it's been fundamentally about kind of AA and recovery groups historically. And, you know, the use of volunteers in the sector as well is something that has been very much kind of embedded in the history of it as people have come out of their own treatment experiences and have wanted to reinvest in. And I think, you know, there are two sides of this. You know, I'm up for people volunteering when they have the resources to do so, and those resources are respected. But I also think that with many people who have a history of drug use, sometimes they're exploited in the volunteering role, and the expertise that they bring by experience isn't respected in the way that a so-called professionals is. And I think that's a problem. So I wouldn't want to see us shift completely to a volunteer model, which seeks to rely on the experience of people who've been through this. I'd rather see them brought in as respected, equal members of teams and paid for their knowledge and their resources. I think as well, you know, it's interesting when we think about the pandemic and harm reduction. I mean, all of the kind of techniques that we're advised to adopt in our lives in order to reduce the virus spreading is very much a harm reduction route. And for so long, harm reduction has been rejected in the UK. And it's great to see that both within society, but within drug treatment specifically, there's a real kind of embracement of that philosophy, because that philosophy is based on an evidence-based approach. So I think we're kind of very much pleased to see that we're returning to that.
Thanks for that. Feel free, everyone else, to chime in if you have some thoughts relevant to the question, by the way. I'm going to take one on housing policy that's come through, and it's, should landlords with empty rooms be made to provide temporary housing if supply is so critical? Sorry to disappoint the questioner. I'm shockingly not going to go full comment on this one. I don't think this is a good idea. First, I guess, like, some homes sitting empty shouldn't be a cause for concern. And the level of empty homes in the UK is fairly low. Well-functioning labour markets, they have friction unemployment as people move from job to job, and a well-functioning housing market should have a degree at least of empty homes and empty rooms as a natural consequence of people moving house. But the second thing that I'd be concerned about here is that you might increase the supply of housing in the short run, but in the long term, you're going to completely ruin it. And the reason is simply that the build-to-rent sector, if this was maintained at least, would cease to exist or virtually cease to exist. People would have no incentive to build to rent if their property was kind of forcibly used in this sort of sense. I mean, if there's some sort of compensation for it, then sure, you could avoid some of those sort of effects. But the concern that I would have there is just undermining long-run housing supply. The next question, this one's for you, Silky, and it's one that I kind of struggle with sometimes. Many people seem to have willingly accepted and supported the lockdown. Does that worry you or suggest that the appetite for civil liberties in the UK public isn't actually very significant? Or do you think this is more a case of kind of lack of public knowledge about some of the more draconian stuff?
I think when the first 3-week lockdown restrictions came into place, there was a huge deal of uncertainty and panic about what was going to come, understandably. We have seen a huge number of excess deaths compared to what there would normally be, of course. And the reason was clear. And the only way that we could have these restrictions is with the willing cooperation of the public. We're not all staying at home because, unlike in actually some other European countries, we're not all staying at home because we're worried that we're going to be arrested or bashed by the police when we go out. We're doing it because we feel that it's important to do for the wider public good. And I think that's why it's so important now for the government to publish its exit strategy, because 3 weeks later, the situation is much clearer, and there's a sense more that I think the government knows what it's dealing with, and we know what the problems are and where they lie. But we have no idea how the government is going to be judging really the necessity and the proportionality of the measures that are in place. These are extraordinary measures, and there's a legal obligation. Of course, they can only stay in place for as long as they are absolutely necessary and proportionate to be there for public health. But that's not really it's not a generalized test that has to be dealt with in quite a specific way. The 5 tests that have been set out are too broad to really be meaningful, and all commentators have more or less said that, certainly in bioethics and other fields. So I think we really need to see now some more detailed reasoning, and also to understand that that necessity test is really important, and the 5 tests are a bit different to that. But we have to maintain a focus, a really sharp lens on the necessity, because otherwise it will be easy to, obviously, we won't have the lockdown as extreme as it is right now. But if we're not incredibly strict about that necessity test, we will see lots of things last way beyond their need, which will see us end up in a very, very strange and dangerous place.
Yeah, I definitely agree on the need for precision in when the government is going to come out of the lockdown. I mean, the concern I have is that sometimes when people say precision, what they mean is set a date like Italy has. And I worry that setting a date rather than having very precise criteria for going out of it, actually, a virus doesn't respect dates, right? Like,
Absolutely.
you've got to have the right measures, 100%. The next question is for you, Maria, and would refugees be able to help farmers who are desperately looking for workers? I think the answer to that is definitely yes, right?
Yeah, absolutely. I know this was an issue flagged by one of our frontline teams, actually, that they'd seen some of the media around this and wondered it would be an area of work where we could focus on the professional backgrounds of people who are in the asylum system who are currently banned from working. And I suppose that's exactly the kind of thing where, whether it was farming or whether it was another area where workers are currently needed, if those people were permitted to take up employment, then absolutely, if they were able to, then they could.
I think we've lost Neve. I think she may have to reboot her computer. That will be done in a few minutes. So we're Neveless for now. Next question that I got through. Let's have a quick look over some of them. There's a few that have been really good. With a proposed tracking app to be centralised via the NHS, would this be more accountable for personal data management rather than a decentralised Apple or Google solution? This is one that I personally think the government's made a massive misstep here in terms of Apple and Google's protections for an NHS tracking app, probably being less dangerous than one controlled by centralised government and the NHS. But Silky, I'm sure you've got some thoughts on that.
Again, we're waiting for detail. It's frustrating to say that, but we're constantly asking for transparency about these things so we can engage, we can develop views on them, and so on. I think the key to this part of the key to this kind of question really is probably in the technical detail. And with the decentralized app, there's three different things that are being asked about here. There's the Apple Google solution. There was a completely decentralized way of doing things that was proposed called DPT3, and that structurally would have been the safest way of doing this, although it still comes with concerns. And I think it's important to look beyond just the technical concerns as well, and consider this, as with everything to do with this issue, pandemic really, look at the social and political impact as well. If each of us starts walking around with an app on our phones that is essentially that's connecting to other people, creating data trails, and trying to see how risky people are based on their health symptoms, that has profound implications. And of course, there's no way that will just stop with a coronavirus. There will be other outbreaks. There'll be other influenza type outbreaks, as there always is. There's lots of other kinds of contagious illnesses that people would have an interest in tracking. And I think we need to think about that incredibly carefully. But the fact that it's being centralized in the way that it is shows that, as I said before, government has decided to do this in quite a centralised and opaque way, and I think we'll pay the price, because you cannot force people to, unless things really change, you won't be able to force people to have this app. It will have to be voluntary. So again, it relies on trust.
Thanks for that, Silky. Final question that I'm going to take before we finish up, because I'm conscious it's nearly 7:15, is for Neve. Thank you for rejoining us. I hope your computer problems and woes have stopped there. The question from an anonymous asker is, what hope is there for those currently going through rehab with local authority funding on their precipice?
That's a good question. I think in terms of residential rehab, we've seen significant decrease in availability, largely linked to funding opportunities. And it still remains a challenge to get people into rehab. It is not the majority treatment approach in this country. I think that's largely because people have to be ready to access that kind of treatment at a certain point in their using experience. That being said, there's nowhere near the sufficient level of beds available. We do know that they are still operating. There's still, the limited numbers that are in place. And it can be an effective social distancing practices in place. But like all areas of drug treatment, it has had significant funding cuts. And that's largely, very much like the group that Maria works with. These are people who are othered in society. They're the people who are the first to be thrown under the bus. And I think in our real concern under this crisis is that they will continue to be thrown under the bus and will be the last groups to be really protected in this crisis.
I think that's an important point to end on, and making sure that we start considering those who are in more vulnerable situations, those who are the least well off in society, and making sure that they're not forgotten in the midst of the COVID-19 pandemic. Thank you all so much for joining us. Thanks to the panelists for the fantastic speeches, and to you watching along at home for taking an hour and 15 minutes out of your Tuesday evening. It's very much appreciated. We'll be announcing our next webinar, which takes place Tuesday next week, very shortly. So keep an eye out on the ASI social media at ASI on Twitter for more details of that. But I guess that's it. Thank you all so much, and I'll see you again soon. Cheers.
Thanks.
Bye.
Bye.